Welcome back to Squawk Box this morning. The COVID-19 pandemic has dealt a heavy blow to America's states. Later this morning, the Commerce Department is going to report on first quarter gross domestic product. That's going to be at the state level, and things likely won't be pretty. Not only did the economy shut down, but states are also having to deal with the massive cost of fighting the coronavirus. However, some states' prospects are better than others. And all day, our Scott Cohn is looking at the state of the states. He is our states expert. And it's good to see you, Scott. What are you thinking?
Good to see you, and good to see you, Andrew. You know, if you follow the calendar, you may have realized that this is normally the day when we would crown America's top state for business. That's in a normal year. CNBC has decided not to do that this year because you may have noticed it is not exactly a normal year. But we are always gathering data, and one of the things that we always look at and looked at especially this year is health care and how states are equipped to deal with whatever this disease has to throw at us. For example, take a look at hospital beds. This is data as of yesterday. Hospital beds available, regular and ICU. Currently, per capita, North Dakota leads the way at 11 intensive care beds per 100,000 people and 203 regular beds. By contrast, Connecticut, where cases have been going down, had just one bed for 100,000 people in the ICU and just 43 regular beds. Now, some state populations are more at risk in terms of pre-existing conditions, according to a study earlier this year by the Kaiser Family Foundation. It says that Utah is least at risk of major complications from COVID-19, with about 30% of the population at risk, while West Virginia is the most at risk at 49%. And every year, the United Health Foundation looks more at overall state health. It's a metric that we look at every year for America's top states for business. This in terms of the health of the population, as well as policies at the state level, like public health care spending and health insurance coverage. This year, Vermont is America's healthiest state overall, according to the United Health Foundation, with low rates of diabetes, a clean environment, and a low rate of uninsured. The least healthy state is Mississippi, with the highest rates of diabetes and cardiovascular deaths, and 12% of the population there is uninsured. That is the sixth highest rate of uninsured in the country. This is always an important part of competitiveness that we look at every year. It is going to be even more so, certainly this year and going forward, as companies still look at states. Even if we're not crowning a top state for business, a lot of that activity is still going on.